It looks like everybody's in. If you want to start, Jim.
Thank you very much, everyone. My name is Jim Hanna. I'm the Director of Transformation and Strategic Partnerships at West Parry Sound Health Center. And it is indeed an honor for me to provide the land acknowledgement at today's Grand Rounds. And as we gather to hear this knowledge, it is important that we declare our intention to use good words and that we gather together with humility and good hearts. We are honored to acknowledge that we stand in partnership across traditional territory of our Anishinaabe partners, friends, and neighbors. We must walk together. We must care for each other. We are a healthcare organization, and during our land acknowledgements, we state, the land is the medicine. The air and the wind across the trees, the water, waves, and the rain, the rock and the soil, the plants and all living creatures that rely on the benefits and generosity of the land. We give thanks to the countless generations of Indigenous people who have cared for these gifts. When land was taken, medicine was taken. As health system leaders hearing this acknowledgement, it is our obligation to join together in giving currency and meaning to these words. We must animate these expressions and move forward with purpose to reconcile and repair relationships, to build new ones, and to seek equitable services and better health for everyone sharing this land. Chimigwech. Kathy?
Thank you, Jim. Today, we're very fortunate to have two of our own staff people here today to present to us on Indigenous cultural awareness, a story of two lies and the truth. We have Connie Foster, who is one of our nurse practitioners with the West Parry Sound Health Center. She works at the Moose Deer Point Station. She's also a registered band member at Shawniga First Nation. She also is one of the leads for mental health and addiction program and a co-lead of the Parry Sound Rapid Access Addiction Medicine Clinic. She is also an Indigenous lead for West Parry Sound Health Center and a healthcare advocate with a passion to ensure that culturally appropriate care and services are included in healthcare planning, implementation, and delivery. We also have Ellen Walker, who is the manager of operations for NP-PHC, program design, data, and implementation. She is the administrative lead for the RAM clinic, as well as the lead for the ALC Community Enhanced Geriatric team. She currently sits on the Crystal Clear Code of Conduct Working Group, newly formed West Parry Sound Health Center Equity Committee, and Anti-Stigma Working Group. Ellen had the privilege of working and studying as part of the Indigenous Health Adaptation to Climate Change Project as she completed her master's in population medicine in epidemiology. Welcome.
Miigwech, and thank you all for attending Grand Rounds today, and also for taking the time for being here and to learn another perspective and to hear my story. Oh, I just can't get the slide to move forward. Ani, Bojo, Connie Foster, Nidishnakas, First Nation.
Sorry, it's still not sharing. Sorry, everyone.
Sorry about that. Okay, I'll start again. Ani Bojo, Connie Foster, Nadishna Kaz, Shawanaka First Nation, Donjaba, Anishinaabe Kwandao. What I just said, hello, I am called Connie Foster and I'm from Shawanaka First Nation, which is 30 minutes north of Parry Sound. I am an Ojibwe woman. And just to add, I'm from the Martin clan and my spirit name is Blue Heron, one who sees. I've just recently received my spirit name in the last year from Rodney Eli, who is a traditional healer. I have not had the opportunity to have my spirit name interpreted into Ojibwe. When I do, I would introduce myself as my spirit real name first, as spirit comes first. Often a spirit name is given in childhood, which I did not have the opportunity or understanding of until the last 10 years of my life. The practice of a naming ceremony and significance was hidden most of my life. And I knew of it partially, but I did not know and connect to the significance or that it would change my way of connection of being and partaking in the world around me. The true essence of who I was so disconnected to myself until I discovered the truth. Finding out I was from the Martin clan made a lot of sense. One who is from this clan can be considered a strategizing warrior, planning ways to defend their own people. The clan system was a system used to organize people in larger groups based on certain family lines or kinship. For example, you would not marry into the same clan. It would be crossing of blood. For example, the Eagle clan, the Bear clan. The Eagle clan could marry into the Bear clan. The clan system was strongly enforced, built upon a framework of equal justice, provided law and order, and it reinforced the teachings and encompassed the principles of a sacred way of life. The Indigenous culture and spirit comes from mind, body, and emotions, which is a holistic model of the makeup of a human being. Spirit represents the true essence of who we really are, which is why our spirit name is named. Connie Foster is a government assigned name and a form of forced assimilation stemming from colonization. Spirit, mind, body, emotions is also the framework of the medicine wheel, and the medicine wheel being a symbol of Indigenous culture and used to represent the Indigenous teachings, values, stories, and beliefs, gives direction, and it is ultimately the circle of life. And when we develop ourselves fully in each quadrant, we live a balanced life, and it is an essential way of living. The medicine wheel also represents the 4 seasons, gives direction. It represents life cycles from birth to the end of our physical life, leaving out the west door to the spirit world, and so much more, including Indigenous beliefs of inclusivity of all races, represented by the color white, red, yellow, black. Indigenous cultural safety trainings, this is just a snapshot. My story of 2 lies and the truth is about uncovering my life through my professional and personal experience combined, and how these discoveries impacted the family that I was born into. My experience is often a similar experience as compared to other Indigenous peoples and what they may have faced as well. Disconnected from the history and culture and having to uncover what was hidden, which I'll speak to in this talk. My goal of the information I'm sharing from my lived experience as a healthcare professional and Indigenous person will help shape your thinking and understanding to some of the issues Indigenous people have faced in their life journey that have directly impacted poorer health outcomes stemming from colonization and the Indian Act, and directly contributed to the continues to perpetuate stigma and racism, intergenerational trauma, and early death. Once one has the knowledge and education, moving from not knowing to knowing and being healthcare professionals, allyship and advocacy becomes a role at the forefront to support inequity and upholding the ways to ensure that we are not doing more harm than good in the work that we perform. How does one go about that in the work that they do day to day. And how does one move forward? Combat oppression, stigma, racism. This is why we're here today, moving towards something to do something about it. A different way to practice, a different way of thinking and acting and understanding, and possibly advocacy in the work that we do as leaders in healthcare delivery. Thinking outside the box. One of the most inspirational quotes that I've connected and shaped my learning is a quote from Richard Buckminster Fuller. If you want to teach people a new way of thinking and doing, don't bother trying to teach them, instead give them a tool, the use of which will lead to new ways of thinking. Using education as a tool to reshape thinking outside the box for change to occur is one idea. With the spotlight on Indigenous cultural safety training for healthcare providers and organizations, I'm hoping that this information can assist to broaden your perspective and understanding what Indigenous peoples may have faced in North America, Ontario, and this region, and to help shape new approaches and ways of thinking and doing and being in this world we live in, and in consideration that we reside and serve a healthcare population along the 400 corridor and throughout Ontario on and off reserve. The overview of the historical points in time is from my perspective and learning. It will be a brief overview scratching the surface of Indigenous historical context from my lived experience of the healthcare provider and Indigenous child, woman, mother, and grandmother. Consider your own knowledge level interpretations of Indigenous knowledge and stories that have been passed on to you as a child, adult, and healthcare professional. Are there any stereotypes that come to mind? It is critical that non-Indigenous Canadians and healthcare professionals become aware of how colonization and the Indian Act were and continue to be used as a tool to control and oppress Indigenous people. This longstanding approach affects all aspects of health and wellness and continues to perpetuate trauma, early death, and continues today. It is also important to understand that the history was well hidden from Indigenous and non-Indigenous Canadians to cover up the actions of the past and power and control, with the goal of wiping out a nation. The thousands of our unmarked graves are an example of the truth coming to light. However, the findings are again minimalized and covered up by our government. As a professional, the healthcare focus now on a client-centered and people-centered approaches and strategic priorities as we move towards Ontario Health Team models, there is a need to develop and build rapport. It would be important from the healthcare access and delivery to understand what factors affect First Nation people in order to provide appropriate care. And what also a strategy could be to develop the compassion and empathy through knowledge building, with one of the goals to decrease stigma and racist approaches. Sometimes we do not know what we do not know, and accepting this in a humbling way to learn. In my personal life as a student, I've learned more about World War II and about the Canadian and First Peoples. Growing up in the Indigenous history was also hidden from my Indigenous mother, which I've come to understand was a way to shelter me from stigma and racism, and inadvertently led to misconceptions and lack of the truth. I lost a connection to my identity as an Indigenous person. Reflecting back at the age of 12, I was walking down the sidewalk in Mississauga, Ontario, where I grew up. And I said to myself, don't step on the cracks or you'll break your mother's back. And I thought to myself, her back is already broken. Thinking back, I was speaking to her broken spirit. Children are very intuitive. And my next thought I had that stopped me in my tracks and took my breath away. I recall the moment as if it was yesterday. I am an Indian, and why is this a secret? It was an epiphany for me, and I did not understand it at the time. However, what I did understand is that I should not tell anyone or speak of it. The answers to my questions were unraveled over the span of my professional and personal life. My mother was born from Jacob Pabus from Shawanaga First Nation and Lily and St. Germain from Rama First Nation, both 100% Ojibwe. My mother's father passed away when my mother was approximately 3 years old, and my grandmother relocated and married a man, Lawrence Williams, from Moose Deer Point. Then the children moved to Moose Deer Point and they went on to have more children. As a professional, I was drawn to the beauty of Georgian Bay landscape and waterfront. Moose Deer Point is a community I currently serve primary health care in for the past 12 years. My mother was quite upset when I accepted the position. She had a fear of my safety. It's not safe there, she said. At that time, I did not truly understand, and the lack of my knowledge and further discovering over the time she was speaking from her lived experience that she was referring to cultural safety. She speaks to self-determination, participation in decision-making, respect for the participation of culture, equity, and non-discrimination, which she did not know how to form the experiences into words. Her experience spoke to the lack of cultural safety. My Indigenous patients and clients I have served, many speak back to the lack of cultural and safety. I've learned that the negative stories and healthcare experiences stem from a lack of safety in their healthcare experiences of the past and present. And some have been passed down through the generations. The hospital is to blame, blaming an experience at bricks and mortar. The hospital building ends up taking the blame for situations of days gone by. This is not just specific to Parry Sound. All hospitals get the blame, so to speak, from the negative experiences. The question is, how do we move past this? From my personal perspective, I came to realize my mother inadvertently tried to cover up being an Ojibwe woman to take the spotlight off her, to deflect stigma and racism. I recall her attempts to assimilate to a Caucasian way of life. She dyed her hair blonde and wore fancy clothes that you can see in this picture as she assimilated later in her life. Her goal was to disconnect from a way of life growing up that contributed to her assimilation to move to the city of Toronto and Mississauga. She married outside her culture. She met my father, a Danish man from Denmark, total opposites. We grew up in the suburbs of Toronto, and my mother spoke minimal about her roots and growing up on a reserve, which I came to find out stemmed from shame, stigma, racism, poverty, and feelings of less than. As the stories my mother faced, it came to the light throughout my own life that it was apparent she was a survivor. And the root cause was because she was born into a trauma-filled environment and she was raised and lived in survival mode, which had an ultimate ripple effect of our family of intergenerational trauma. The history of colonization and stigma and racism significantly impacted her, as well as my brother, sister, and daughter, which circumstances all led to poor health outcomes and early death as well. The ripple effect of the intergenerational trauma continued and was passed on to my sister, brother, and daughter. All different circumstances with the common thread of stigma and racism and early death linked back to the impact of colonization and the destruction over a nation over the years and the mindset, approaches, and stereotypes. Colonization in Canada. The definition from the Oxford Dictionary of colonization is the act of taking control of an area or a country that is not your own, especially using force and sending people from your own country to live there and take over. Colonization speaks to the actions or process of establishing control over a nation for Indigenous people who have been here in Canada for thousands of years before the European settlers arrived, which at that time, the 11th century, for the Indigenous population at that point ranged from anywhere from 8 million to 112 million. Thousands of years before the arrival of the explorers and traders, Indigenous people were organized into complex self-governing nations throughout the land, and over time became what is known as North America, including Canada. North America continued to be occupied by Indigenous people living at the time where they were referred to as Indians or less than humans. However, Indigenous people were thriving in their own distinct cultures, languages, and ways of knowing. Indigenous peoples had been living off the land for thousands of years with their own cultures and civilization. The goal ultimately was to take over the lands and founded and claimed as their own by the explorers. The impact that the settlers and the Europeans brought began to give their own names and descriptions to the land that they had discovered. For example, Vancouver and Vancouver Island are named after Captain George Vancouver, who was born in England in 1757 and not named after the chief of the territory whose family had lived in the area since the beginning of time. The landmarks and bodies of water and mountain ranges all were given names, which had already previously been named by Indigenous peoples. This was one way to to rewrite Indigenous people out of the history and the Indigenous ties. The colonizers' view valued competition, individualism, and male superiority. On the Indigenous worldview, Indigenous people value the group or the collective more than the individual. Each person has a role and each contributed to the success of the group. The impact of disease. European settlers brought smallpox and other diseases which were previously unknown in North America. The Indigenous population had no immunity at this time. Unlike the Europeans, they did not have, which they didn't have for centuries of which they did have for centuries of exposures to these diseases. It was estimated that about 90 to 95% of Indigenous populations died from these introduced diseases. These deadly epidemics happened before either the settlers or Indigenous peoples properly understood the causes of diseases at that time. Christian missionaries told Indigenous people that one of the reasons that their illnesses and why they were sick was that they did not believe in the Christian God and they didn't attend church. Indigenous people saw the settlers were not as badly affected by the disease, and many were persuaded to abandon their traditional beliefs and convert to Christianity. It was really at that time very black and white, and it actually still exists today. From my personal experience, I worked up in the Sioux Fly-In Zone for about 4 years, and I thought I would go up there and find my culture and discover powwows and a place of belonging. What I found were third world conditions, devastation with mental health and addictions, a broken family system. Many of the parents were addicted to Percocets and Oxys. Grandparents were caring for their grandchildren. Intergenerational trauma was highly visible. The church was the focus in most communities, and there was definitely a fear of discussing culture and powwows. Sweat lodges were hidden, and there was a lot of parties going on, poor housing infested with mold, broken windows, poor sanitation, boil water advisories, and domestic violence, and lots of suicide. The loss of culture was a way of life and is still rampant and still evident today. What is left is a shell of a person without the tools of survival. Think about the medicine wheel I spoke of earlier and the holistic way of being and living. My personal experience, my mother's family is from Shawanaga First Nation, Grandma, and Moose Deer Point First Nation. These communities were not connected as you would expect in a family when I was growing up. My grandmother in her younger days would make porcupine quill baskets and sweetgrass. And after a while, this practice went to the wayside and it was replaced with the church Christianity, and everywhere she went, she carried a Bible. There was a lot of confusion around culture and religion. One is good, one is evil. Culture from the beginning as a way of life in harmony with the land, people, and animals, where imposed religion was a tool of power and control. Brainwashing, much different than the real act of spirituality that we know today. A lot of confusion and misconceptions still go on today. However, with education and knowledge and healing, the blending of two worlds is starting to happen. My late daughter, Crystal Gracie, was trained as an Indigenous pastor, so we're starting to see the blending of two worldviews. The Indian Act came into power in 1876, with many revisions over the years up until the present day. The roots of the Indian Act lie in the Bagot Report in 1876, which provided a framework for the Indian Act that recommended Indian matters be centralized and handed over to the federal government. The goal was to assimilate Indigenous into non-Indigenous societies, created reserves, pockets of land, and a way to segregate, isolate, and easier control of. That's when residential schools were implemented. The Indian Act restricted First Nation from leaving their reserve without permission. The rule of the Indian agent, which was a method to control the movement of Indigenous people between their outside communities and families. And this was in effect from 1870 up until 1960s. It forbade First Nation from forming political organizations and prohibited sale of alcohol to First Nation and purchasing ammunition. And the list goes on. The Indian agent was not removed from the Indian Act until 1995, which also regulated the goods of sales of food, and products off of reserves. This is just an overview of the Indian Act as different points in time. It was embedded and changed and revised, but it's still in place today, even with the name of the Indian Act. For my professional experience, part of my career, again, have been spent working with the Indigenous population up in the flying communities. In Ontario, the stories I heard from the community members were a pattern of devastation, loss of culture and identity, displaced from their families, government documents going missing, fear of the government. Many Indigenous people are still trying to regain their status. Even in my own family practice at Moose Deer Point, it is impossible, and we have tried for one of the clients there to prove his identity, which was taken at childhood, and he's now in his 90s, which I don't think we'll be able to retrieve those documents. It's important to understand that the land base, as it relates to isolation and other factors enabling power and control. Moose Deer Point is where I'm providing primary care right now, and up until the 1960s, it was the late 1960s, it was a flying community. And if you look at the land base along the 400 corridor, you can visibly see the isolated pockets of land known as reserves, and how it relates today to the difficulty of services and healthcare access layered on top of another barriers after barriers. From my personal experience in relationship to the Indian Act, my mother was paid $200 from the government to take away her rights as Indian status when she married my non-Indigenous father. It was enough to buy a car at that time, and it was explained to be a benefit. Bill C-31, April 17th in 1985 was introduced, and this amendment to the Indian Act, which reinstated status to women who had lost it through marriage to non-status males. The Indian Act did not include Indigenous males who married non-Indigenous females. Those females who were Caucasian that married an Indigenous man actually gained status, where in my situation, my mother lost her status. And it still exists today. What the solution for that was, the Caucasian women that had Indian status would soon die off. So in 1984, my mother gained back her status, and as well as her children and myself. We obtained status, so now I'm an Indian. This changed my identity. I was in my 20s. It was a whole identity shift for our family. What does this all mean? I'm now the same as my relatives on a reserve. What is a reserve? It's very confusing times for me. Residential schools system operated from 1880s to 1986. It was cultural genocide. Children died from diseases due to the overcrowding and malnutrition, poor sanitation, died from being abused, trying to flee the situation and get home. So up in the flying communities, up in Northern Ontario, where I worked for Health Canada, a lot of the stories came out about the abuse, the distrust of the government. It was very apparent of the fear of nurses. Historically, they would be often the whistleblowers on the parents who tried to keep the children home or hidden to prevent them from being forcibly taken to residential schools. I heard the stories of deep sadness, trauma, as they spoke of the schooling system and what their face and haunting in their eyes and tears welling up in shame and abuse, and first-time disclosures of the abuse that they experienced during the residential school era. My personal experience, I have not had a direct family member experience of residential schools yet. It hasn't come out. My mother did attend school at Moose Deer Point First Nation. It was a one-room building and described as very strict and demeaning atmosphere. There were not even, that was not uncommon in that era. However, there was another layer added to it, the environment and the superiority. In my mother's voice, the teachers did not like us, treated us poorly for no reason, made trouble for us. I don't know why it was like this. It was so scary being a child. We couldn't even speak the language. I lost the language and my desire to speak it. The 60s scoop. The 60s scoop was a period that began in the mid-1950s. A series of policies were enacted in Canada that enabled child welfare authorities to take over Indigenous children from families and communities. Approximately 20,000 Indigenous children were taken from their families and forced into foster care, out to middle-class Caucasian families who were most often forcibly adopted. Often on the other spectrum, they weren't adopted because then they had provided an income for that family. The mindset of the Indigenous peoples that they didn't have the skills to take care of their children. The 60 scoop continued up until the 1980s, and it's still the mindset of today in some experiences. From my professional experience, 2007, I graduated as an NP. In 2009, I had my first 2 years at the Barrie Family Health Team. Then I accepted a position at a community health center as the Indigenous NP. And I was a new NP too, so then I had full-blown imposter syndrome. As well as being in the Indigenous NP, I was still trying to figure out who I was. And the patient population that I was serving at that time were waiting for this Indigenous nurse practitioner to come. And with them came many stories. There was lineups, stories of being taken from their family at an early age, placed in foster care, residential schooling. The healthcare issues brought forward spoke of depression, anxiety, PTSD, suicidal ideations with plans, loss of culture, returning back to their families and trying to fit in and reclaim what was lost. The question was, how do we treat this? My colleagues that I was working with at the time wondered what was wrong with my patient population. From my personal experience, my professional and my professional experiences started to collide with my personal experience too. My mother had a very similar story that was uncovered, and the pieces of the puzzle of her life and as a family began to fall into place. So my mother had a daughter, a child, before she had met my father. My mother decided to leave Moose Deer Point and relocate to Aurelia at the age of 21. And this was in 1960. She went to CAS in Aurelia for help. She didn't consume alcohol or use drugs or even smoke cigarettes at this time. The CAS, the help that they offered was a babysitting arrangement, and with my mother. So Lori was placed on a farm with a Caucasian family in Romero Township, and my mother was sent to take care of another family and told that if she got back on her feet, she'd get her daughter back. She didn't get paid for the work, and she decided to move to Toronto, where she met my father, and he insisted on helping to try to get her daughter back. At the age of 12, Lori was able to decide where she wanted to live, and because of the lies she was told, she stayed in foster care. Later on, the stories came out that she was told that my mother had abandoned her and that she was nothing but trouble. The CAS told my parents at this time that if she wanted to get her back, since it was a babysitting arrangement, they would have to pay thousands of dollars, and they decided to walk away. When I was 22, my sister Lori found us as a family. She was in search of her roots and her identity. We became the closest of sisters for 25 years, and during that time, it was difficult for Lori. Everything she believed about herself was not true. Eventually, Lori and her husband moved to Winnipeg, and she wanted to start a new life, take a break, and collect herself and start over. She came back to Ontario a few times for a visit. And one of the visits, the foster care family that had raised her actually contacted me and informed me that Lori was seeking prescription drugs and topping it up with alcohol. And they asked if I could help. Unfortunately, at the age of 46, she passed away from a liver virus. Later uncovering the truth, it was cirrhosis of the liver. I started putting the pieces together of my patient's experiences at the community health center and my mom's CAS experience, that this was much more of a bigger story than we knew. I told my mother that her experience didn't just happen to her. Through the investigations, it came to light that Lori was one of the first 60 scoop children in Aurelia, and the aftermath of her experience led to depression, anxiety, loss of culture, abuse, substance use disorder, and a means to cope, and early death. My mother gave me permission to tell the story, and the story continues. My parents had their first child, James. After they met in Toronto, they decided to move up to Timmins, where my father got a job up in the gold mines. And so James was 4 months old, and during his first months of life, my mother kept bringing the baby to the hospital up in Timmins and saying there's something wrong with him. She didn't want to make too many waves. She was afraid that another child would be apprehended. She didn't push the issue. And from what she told me, She didn't want to make too many waves and stand out. And finally, the medical staff realized the baby actually had water on the brain and required a shunt. And they were sent on the train down to Sick Kids in Toronto. And on the way down to Toronto, James passed away in their arms. He's currently buried at Moose Deer Point. So what is stigma? Stigma can be defined as a complex and powerful social process of labeling, stereotyping, and devaluation that leads to status loss and discrimination. What's important to note that all of this occurs in the context of power, and only power social groups have the ability to stigmatize. What is racism? So racism is a system of oppression whereby a person of a dominant racial group exercise power over privilege over the non-dominant group. Stigma in the healthcare system. So negatively affects people at their most vulnerable. There's negative attitudes, fears, beliefs, lack of awareness, institutional practices are instilled, influences individual health outcomes, denial of care, substandard care, physical and verbal abuse, increased wait times, passing off of healthcare issues. So it does affect a person's wellness and health and poorer health outcomes. So coming to light, there are many media reports of recent stigma and racism in the healthcare system. Joyce Aquan, one of the most recent in the news and the media, that highlights widespread racism and discrimination. Joyce filmed herself in the hospital, screaming in distress as staff members made derogatory comments. Sadie North, an Indigenous elder who was accused of being drunk when suffering from sepsis. She was so sick that she could hardly walk. They didn't connect it, that it was connected to her diabetes. I think about 4 years ago, it was in the media about the BC hospital ER staff playing the game, guessing the Indigenous blood alcohol level on the Indigenous people that came into for care. A healthcare worker reported it. Anne-Marie Garrick experience was left in tears after a racist encounter with an ultrasound technician at the Windsor Hospital. And what she was told, you know what the problem is with you people, you guys drink too much. Brian Sinclair in 2008, he was the story that was ignored to death in a waiting room. He waited there for 34 hours. He was not properly triaged. They just thought maybe he was there looking for somewhere to sleep and just to be. Meanwhile, he had showed up with a letter from his doctor that he needed to receive urgent care. And so this is the story that can be looked up in the book called The Structure of Indifference, and it talks about this story. From my professional experience, one of my clients, a high-profile Caucasian male, was admitted to a local hospital. He was admitted to the ward with 3 other Indigenous males after surgery. And he said you could cut the environment in the room with a knife. It was quite visible and apparent. The medical staff approached him, and their tone was different than how they approached the 3 other gentlemen in the room. And he asked me if I could bring the story forward as well and what could be done about that. And a patient of mine from Moose Deer Point also gave me permission to tell her story. She was diagnosed with epilepsy in childhood, came in with symptoms of, unfortunately, that led to a diagnosis of a rare cancer. And it spread quickly, and she was at the age of 45. And her treatments were at the tail end of COVID and last year. She was treated for palliative radiation in 1 round and went in for the next round. Prior to her treatment, she had a seizure, and she was coming out of the seizure, and she could hear the staff asking how much alcohol she had drank and was trying to question her. Went out to the waiting room, asked her partner how much alcohol she had drank, and he said she doesn't drink alcohol. This is she does have atypical seizures. And so she did ask me to, the last couple of days of her life, to bring that story forward and for something to be done about it. And also from my personal experience, my mother, unfortunately, in the age of late 70s, she was diagnosed with lung cancer. Even, when we consider 70, it really isn't that old as we get up there in age. And it was quite surprising because she actually lived a healthy life. She rarely smoked. She rarely consumed alcohol, worked out most days of her life. She was at the gym. She ate a healthy diet. But the research indicates that emotions stemming from trauma and not treated correctly or released from the neurological system can be a direct link to cancer. She tried to get counseling at various points in her time during her life and was told, "We don't know what you have." The question is, how do you identify and effectively treat the effects of colonization and the Indian Act and the 60 Scoop? My daughter, Crystal Gracie, at the age of 27, was diagnosed with hereditary angioedema type 3 and sarcoidosis. During this time, which was during COVID as well, she faced many layers of stigma and racism accessing the healthcare system. She identified as Indigenous when entering the healthcare system at every time so that she could get connected to Indigenous services and support. Due to the complexity of her illness and a strong pain component that comes along with hereditary angioedema, her pain was often unmanaged. It was, thought of that she was often drug seeking. You could hear it in the tone and the approach that she received. It was visible. She would be yelled at, "Use your toolbox," and they just walk away and leave her. Charts were not properly reviewed. The tone of delivering her meds was, "Why do you even need this anyways?" Of course, COVID added another layer to that as well. I think a lot of what she experienced was a lack of understanding of how to help her with such a complex, complicated medical history. She needed a holistic full team approach, which would have helped. Specialists often don't consult together. And just to note, she also did receive good care as well, actually great care at different points. So looking at solutions, and so just looking at one thing to consider is when a powerful oppressor has been directed, when a powerful oppressor has directed oppression against a group for a period of time, members of the oppressed group feel powerless and fight back, and they eventually turn the anger onto each other. And so that's one of the aspects if we're thinking of moving forward, understanding the perspective of the Indigenous client, Indigenous community member, where that might stem from this anger. And also when we think about blaming the hospital, which is bricks and mortar, to our past and to their past experiences. And so the Truth and Reconciliation Commission came in from the fallout of the Indigenous residential schools. And that was 94 recommendations were made. And to this day, there is been minimal movement on these recommendations of calls to action. So another solution is looking at it from a two-eyed seeing approach. A two-eyed seeing develops from the teachings of Chief Charles Labrador of Acadia First Nation and Mi'kmaq Elder. The two-eyed seeing refers to learning to see from one eye with the strengths of the Indigenous knowledge of the ways of knowing, and from the other eye with the strengths of the Western knowledge and ways of knowing, and to use both of these eyes together to benefit us all. Two ways of the world allow a diverse group of people to use all the understandings to improve the world. And removing barriers too would be important as well when we think about strong leadership and support is required if we're going to move forward in better health outcomes. Taking a leadership role in tackling stigma, interrupt the process before it starts, structural changes, modeling first-person behaviors, education, policy, and putting in safe care measures. When my daughter passed away, she was brought to the West Perry Sound Health Center to access the healing room. And again, COVID times at the tail end of COVID in March 2022. I checked in as the mother, not the nurse practitioner now, and I explained that my daughter was being brought in for her ceremonial cedar bath. And the response was that I got, "Oh, did she die of an overdose?" In the moment, I decided not to take the comment personally and understand that sometimes one does not know what they do not know. And what could I do with this? 5 weeks after my daughter passed away, I went to the First Nation communities and Indigenous friendship centers and sought pledge support for the idea to enact an anti-stigma and anti-racist policy and reporting system that I presented to the West Perry Sound Health Center leadership, which was approved to move forward with a working group. And so the working group was formed with Indigenous engagement, and the Crystal Clear Code of Conduct was developed with the promise of Indigenous engagement. The policy is rooted in education. It is currently in draft form and ready to be sent out to our Indigenous communities for engagement and feedback. Once the process is completed, it will be signed by all the board members, staff, volunteers, students, and this will be part of the hiring process. Moving forward from this day when it is enacted, it'll be crystal clear of the expected code of conduct under the umbrella of the West Perry Sound Health Center. And there's the policy there in draft form. And the background for this policy and my daughter's story will stay with the policy. And we are hoping that this policy can be shared with other healthcare organizations. And the goal is to work on a toolkit that can be shared. And right now there is spotlight on the policy with Ontario Health Teams, the College of Nurses, and the International Indigenous Friendship Centers of Ontario. And I'll turn it over to Ellen.
Thank you, Connie, for sharing these incredibly important stories. And Connie, I'm looking at the time here, and
Yeah.
Kathy as well, and wondering if maybe if we'd like to open this up to questions, or if you'd like me to go ahead as well.
Well, I think from what Ellen was going to bring forward was just that from a leadership perspective in our organizations that we commit to changes and looking at ways of thinking outside the box. And also just to add with that, and sorry about the time, Ellen, but just to realize too that my story amongst Indigenous people, disconnected from their heritage, culture, and not knowing at various levels and experiences, each Indigenous person needs to be assessed individually as to their lived experience and what they want to have included in the healthcare, build that trust and rapport and safety of care and a system that is safe with policies and a way to deal with any reports that do come into their healthcare organization. And just to consider how this information can impact your practice moving forward. I do have a poem that I would like to read as well, and then we can move towards the questions. And if there's any further questions, you can always email me or let Kathy Hamer know. The medical model as healthcare religion. I thirst for that knowledge and way of knowing. Ways of the world I have questioned. Do you have an Indigenous voice guiding your healthcare policies and delivery of service? A two-eyed seeing approach is not just a concept. It's a benefit to us all, a blended understanding of all considerations of healing. Unfortunately, the Indigenous framework is a blinded reality that's put at the bottom, trumped by the medical model, especially in days gone by. I've had spiritual surgery, and I could write a book about the medicine men that have saved my life. I would not be here today because of it. Does this not count as healing and treatment? Science is to question all other domains. The Western way, how has this become more dominant, put on a pedestal? We glorify the Western medicine's power to tell us what to do as the holy truth of healthcare religion. Indigenous people and others, be open to hear. Do not be fooled. We have been succumbed by its beliefs and values if we think in this regard. The idea of putting all your eggs in one basket is blinded by the truth and could be seen as living on a hope and a prayer and a very risky practice. Do not be blinded to disregard the truth and ways of knowing. It is part of the Indigenous teachings. 4 feathers versus 1 feather is another bird's eye view. It would be important to include the medicine will framework. The question is, for some, Be open to see beyond the boundaries that have been stereotypically created, often unknowingly. In our decision-making and advocacy platforms, unite healthcare delivery, policies and program development, equal funding, not lessen our neighbors, harmonize. Consider the grandfather teachings our generations to come are praying for this generation's wise interpretation and actions. Please do not bow down to another form of colonization, to put the westernized approaches again on a pedestal as the main priority and following. An opportunity awaits, wise one. You took the opportunity to learn today. Miigwech.
Thank you so much, Connie. And I would just like to say that thank you to Connie again for telling you your story, or for telling us your story. And as my friend and my colleague and my mentor, you're a leader for change, and we are so grateful to have you on our team and as a partner for that change. And you've done so much work already in this in your lifetime, and I'm just so excited at the opportunity to work with you and to continue along this journey with our health center.
Miigwech, thank you so much for helping with the work that you've done, and even through the process of when you were on mat leave, and help me walk through the process of what I was dealing with at that time and see a different view, which led to the crystal clear policy. Thank you, Miigwech. And if there's any questions.
If anyone has any questions, just go ahead and unmute yourself. There is one comment in the chat box I'll read. Thank you very much for your story and your work. And Dr. Juno has also added, thank you so much, Connie. Your presentation is profound and your work is inspiring.
Miigwech.
So I think while we wait for some more questions to come in, I'd like to just to say that we're working toward structured cultural safety. So we have had an opportunity to have our senior leaders and board members take part in cultural safety training and allyship training, as well as frontline staff. And we have set up structured mandatory and annual training for all staff through the Surge Learning platform. But this is really just the tip of the iceberg. And I just want to recognize that by taking one course or a lifetime of courses, that doesn't mean that we or I know everything about Indigenous cultural safety and what it means to be allies and better allies and to provide that care. So if you're on this journey with me to learning more, please continue. I assure you that you and I are not done in our learning process, and that if you're just tipping, you've just touched your toes to the surface of this learning, I really encourage you to dive deeper and to take the time to learn as much as you can.
Susan's also added in the chat box. Thank you. We are listening.
Thank you, Miigwech. And thank you again for everyone attending and listening to my story.
And one last final call for questions, comments. I'm not hearing or seeing anything. Thank you very much, Connie, for coming and sharing your story today. It's been quite a learning journey for our last rounds for the year. And thank you, Ellen, for adding administration's perspective as well. It's moving forward so that we can make things better for everybody. So wrapping up for the year. Thank you everyone for attending our rounds. We will be resuming in September, and Jess will be adding the posters as we get closer to the time. Thank you. Have a wonderful summer, everyone.
Thank you, Miigwech.
Thank you.